Okay, good morning again, everybody. Welcome to chapter 13 in tests and measurements. So let me pull up my screen and we shall proceed. Okay, folks, for this chapter, we're going to be talking about clinical instruments and methods, approaches to doing assessment. Okay, now this course is about tests and measurements, but this chapter gets into the broader area of assessment. Yeah, collecting data outside of the test situation, and this is important to keep in mind because in terms of collecting data on clients, or patients, um, we certainly do a lot of other things besides just using psychological tests. Yeah, and what's really part of the norm is to collect behavioral data. Yeah, so that's what we're going to be talking about in this chapter. So let us proceed. All right, one area actually isn't done so often, but should be done more often by psychologists, is collecting is conducting environmental assessment. Yeah. Now, environmental assessment is, as the term kind of suggests here, collecting data about the client's environment. Okay. It could be the work environment, school. Now, school environment assessment is very commonly done in child work. Yeah, especially if someone is being referred for treatment or set evaluation for things like ADHD. Yeah, it's very common for psychologists to actually go to the school setting to observe the child, in their natural environment, to examine the interactions with fellow students and their teachers. Okay, to then facilitate treatment of the individual, but also to provide consultation to the school, to the teachers. All righty. Now, I just also want to make this clear. This is of the types of environmental science assessment. This is the area that's more routinely done, school settings. But it's probably fair to say that most psychologists still don't do this. Yeah, which is who do child work. Now, so moving right along, though, so that's one area of environmental assessment. The other is occupational assessment, as well as home assessment. Yeah, so those big areas, which environmental circumstances, which account for most of people's daily functioning. Yeah, schoolwork and home. Now, essentially, what is done is a systematic measurement of the environment. Okay, so for example, let's look at so some common things that are measured will be things related to parents level. Well, let me take a step back. One of the things that are considered as part of environmental assessment in examining family circumstances is socioeconomic status. Yeah, very most SES indices will take into account the parent's level of education, family income, as well as occupational classification. Yeah, which suggests things in terms of their financial circumstances, resources, as well as opportunities for intellectual, occupational, professional advancement. Yeah. Another type of environmental assessment is, as I mentioned previously, assessing the home. Yeah, and one form of one tool for assessing the home is actually an instrument called the home observation for measurement of the environment. Big surprise with the acronym HOME, which takes into account things such as cleanliness, resources, opportunities for privacy, as well as family interaction, and so on. Now, another area of clinical assessment is behavioral assessment. This is very commonly done. Probably most psychologists do this to varying degrees. Yeah, those certainly who adhere more to behavioral theory and approaches will do a lot of what we're going to be talking about right now. Okay. Now, what are three principles behind behavioral assessment? Okay. Well, the idea behind behavioral assessment is that you would quantify behaviors, yeah, things you can observe. What would be examples? Yeah, let's just say in couples treatment, you would observe how they resolve a conflict. Okay, you might even measure things such as if they start raising their voices, the volume of their voices, yeah, words that are used, yeah, in the resolution of a conflict between a couple. Yeah, do they start using personalization as part of their you know attempts to resolve a problem, right? Blaming of the other, yeah, or do they limit it to focusing on the problem? Alrighty, you might even observe other behaviors like, let's just say, facial expressions of disgust or contempt. Yeah, which you may have heard, in research that has examined couples, um, conflict resolution. Yeah, now one of the big predictors for later divorce in marriage um, um, are looks of disgust or contempt. Yeah. And those looks aren't just nasty looks, right? They communicate things. A look of disgust or contempt communicates, yeah, the idea that the person thinks that you're beneath them, yeah, and that they don't want to have anything to do with you. As opposed to someone can be angry and frustrated, yeah, but not communicate with their face or wording that they think you're below them, or they don't want to have anything to do, or that they want to end the relationship or not have anything to do with you. Whereas a look of contempt and disgust certainly has, excuse me, those connotations, whether intentional or otherwise. Yeah. Um, Another principle of behavioral assessment is when observing, say, a child in a classroom, let's see, someone in the work setting, yeah, and how they work with others in a particular work environment, antecedents and consequences. Yeah. So, what are the things that immediately precede someone having a conflict at work? Yeah, maybe a poor interaction or difficulty with resolving a problem with a coworker or with a supervisor. And then what immediately follows? What are the consequences? Yeah. And looking for ways in which behavior that preceded the consequences are either reinforced positively or negatively, or punished either positively or negatively. Yeah. I won't get into the differences between positive and negative reinforcement and positive negative punishment, but those are the consequences you'd want to see in order to determine what behaviors are being reinforced or increased, or behaviors being decreased. And what's really an important principle with this behavioral assessment is that all this data you can collect, yeah, in terms of what goes on in school setting, facial expression, voice volume, how certain behaviors are being reinforced. Someone could be reinforced for being aggressive. Yeah. Sometimes, for example, in an interaction, couple, family, work situation, maybe those around the person who has the anger problem, right? Maybe they concede very quickly, yeah, or they give in, and so on. And maybe when people do that, they give in too quickly or they concede too quickly. Yeah, that's a powerful negative reinforcement for the aggressive behavior. Yeah, because you have the removal for the person who has the anger problem. When someone concedes way too quickly or gives up too quickly in an argument, right, that removes the aversive situation, right, the conflict for the aggressor, right, which increases whatever aggressive behaviors they were doing right before the concession. Yeah. So that's one thing you can educate the people involved in that situation. Yeah. Not to have an increasing aggressivity, but now how they could, instead of conceding or giving up quickly, how they can continue to try to resolve, problem solve in a way that reduces the aggression. Yeah. But not just give up or give in so quickly, which just reinforces um, aggressive behavior. Yeah, by way of negative reinforcement. All righty. Now, there are different categories of behavioral assessment. Yeah, one is the direct or naturalistic observation, like the example with placing oneself in a school setting. And when someone does that, it doesn't have to be like for days. Very often, when people do this, all it takes is observing a child maybe with two or three teachers. Yeah, and that could be like maybe 2, 3 hours, and you can collect tons of data about what might be going on with an ADHD um, child. Another category of assessment is by way of using analog behaviors. Yeah. So maybe it may not be convenient or practical to go into the actual setting, but the other thing psychologists very frequently do, this very common clinical intervention. It's seen usually it's an intervention, but it's also an assessment technique, is to do role playing. Yeah. So maybe you might have a client come in because of social phobia. They want to increase their dating behavior, but one of the things they have a problem with is with assertiveness and approaching people to, engage them in a social interaction. So what the psychologist can do with the client in that situation is kind of role play. Yeah. It very typically will start off with having the client maybe role play what they do, right? So they might pretend, right, role play that they're at a bookstore and that the client wants to ask somebody about a book they're reading. Okay, so they would role play as a client would typically do it, with the psychologist being the person that the client wants to approach. All righty. Then they would critique, how that went, what the client did, which was effective and what was probably not effective, and then they would see how they can improve on that, and then do a second kind of a take, so to speak, kind of like a movie, like with a little what is that, cue thing, where you do take two, and then you do the same role play, but taking into account the feedback that the client got from the psychologist, and then trying to role play, pretend, uh, doing the assertive behaviors, okay, or the more assertive behaviors. Alrighty, and then working on that, critiquing that, and you can think of it almost like learning a musical instrument, right? That you play in front of the instructor. The instructor gives you feedback, and then you try to play a piece of music again. Same thing with human behavior. In fact, that's a very common analogy used with clients. That it's not a matter of being an assertive person, or even having an assertive trait, if you wanted to go there. I mean, there's nothing wrong with that conception of traits like the big five. But even getting away from that, saying that all we're doing is seeing or is examining behaviors and how you can change those behaviors. Yeah, just like learning a musical instrument. The other is by doing behavioral interviewing. Okay, and this is where you would do, the psychologist would do a behavioral analysis. Yeah, very typical term when doing a behavioral interview, where you collect information from the couple, families, individual, about circumstances that they're working on, they have problems with. Again, looking at antecedents, consequences, but also breaking down the behavior. Into very specific concrete things that happen, and getting very specific details about frequency, intensity, and duration of behaviors. Another common category of behavioral assessment is self-monitoring and self-report. Yeah. So this is a situation where clients, a very common technique and intervention, are directed to collect data on their behavior. Yeah. So, for example, if someone has hand washing as a obsessive compulsive ritual, yeah, the client would monitor how many times they wash their hands. Yeah. But they would also do things such as record, right? What were the antecedents to that behavior? Were there certain things that seem to be triggers or set off obsessive thoughts? Also, recording what those obsessive thoughts were. Yeah, recording the behavior. What did they do? Wash their hands, right? And then record immediately afterwards what happened. Were there any consequences? Like, what did they say to themselves? How did they feel? Or how did people treat them after perhaps a hand washing? Okay. And then it often takes it does. It just takes work on the client's part to do this, but it can be really helpful in many kinds of situations like OCD, panic attacks. Yeah, depression it can be a very common one. Reality is that it's a little harder with depressed individuals to get them to do this work because part of the problem that they're experiencing in the first place is doing stuff. Um, Oddly enough, for anxious people, they tend to be a little better with doing this, particularly all jokes aside. Actually, maybe no jokes aside. With OCD, they're very good with these kinds of assignments. But you can actually even, it's almost like using the pathology to treat the pathology, have the person really monitor obsessively their behaviors. And it's an old tried and true maxim, and there's research to support it, that behavior that's observed is often subject to change, yeah, in either direction, and very often the direction, the desired objective. Yeah. So, for example, if you want to increase studying behavior, yeah, start recording in a calendar, just in your date book or on your phone, um, how many minutes you're reading or studying, and just being conscious of that alters human behavior. Very powerful intervention, by the way. Good self-help technique for those of you who are trying to increase exercising or decrease, eating fatty foods. Just start recording it, and you'll be more conscious of it, aware of it, and it will alter your behavior, usually in the direction that's desired. And finally, cognitive assessment is recording, big surprise, thoughts that people experience related to the problems. And I won't go into this again. I think I described it earlier with the example of OCD. Okay. Now, some comments about behavioral assessment. Alrighty. Incredibly valuable information for the clinician. Alrighty. And it's a way to be scientific about it, quantifying behaviors you want to change and observing them over time. And you can observe what interventions work and what don't work, and very powerful and scientific way of approaching clinical work. Alrighty. That said, um, reality is just like any good work, it's time consuming and can be cumbersome. So it's the task or the skills of the clinician to come up with ways which are creative, imaginative, motivating for the client. Yeah, so you don't just want to use a boilerplate homework assignment with a client. Now, homework assignments can be quite effective. Yeah, but people have to stick with it, and that is the challenge of doing behavior therapy, is helping the clients, right? That's the skill of being a good clinician. Yeah, is really being like an athletic coach, right? Motivating them, having them stick to a regimen, and so on. Yeah, and when you do that, you experience changes. All righty. Now, when it comes to self-monitoring, self-report, I didn't discuss self-reports specifically, but it's similar to what we had spoken about regarding self-monitoring. Yeah, you might self-report levels of depression every day, how sad you're feeling, and rate it on a Likert scale, and then bring that data in. Yeah, usually that's also done with recording antecedents and consequences. That's why kind of self-monitoring, self-report can be in the same category. Um, so what are some issues with self-report? Well, just the nature of self-report, right? It's going to be as good as the person who's giving the report. So it's going to be a function of how honest they can be with themselves. Yeah, and to be quite frank, how accurate, right? How diligent they are to sticking with the homework. You have to do it on some days and not others, certain parts of the day and not others. It's going to affect the quality of your data. In terms of social desirability, right? Is a client giving the clinician data to make the clinician feel better about herself or himself, all right? Making the therapist feel like, oh yeah, I'm getting better, so I'll just, say that I'm getting less depressed, right? So you want to look out for that too. That can be an issue. Yeah. And also, again, kind of touched on just a second ago, sampling. Yes, you want to be sure you get a good amount of data. And a good amount of data, it kind of depends on the individual, the problem, and so on. Yeah. So, for example, it's probably reasonable when looking at a child with ADHD is, a few hours um, on 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 a given day, but not every day, right? Because it's just going to be not, it'll be impractical to get that from the teachers, to get that from the child, but maybe doing it, once a week on random days of the week, every week for, as treatment's going along. Yeah, so you do it Monday, then Thursday, then Wednesday, Tuesday, Friday. So you bounce between different days, different times of the day. Across the treatment period, which might be what, like for example, like 3 months, 3 to 4 months, right? So that's, if it's 4 months, that's 16 weeks, right? But you vary the days and times just because, so that you get a good sampling. Right? You don't want to do it all on Friday in the morning, because maybe Friday mornings is when the kids, that kid is particularly good because they're in a good mood or whatever, they're tired, you don't know. But if you vary the days and times across a 16-week period, you're more likely to get a better sampling. Yeah, because, okay, you got different days and times. Okay. And also, you have the same issue as you do with psychometric tests. In other words, in the absence of norms. Right? And with some of these things, like ADHD, you may have norms, right? Some people may have collected this kind of data, might have group generated data, so that you can compare your individual case with that, right? I mean, it's not as like as a tight relationship as when you compare a person's individual score with the scores for 300 people, but at least you have some normative point of comparison. Yeah. But if you don't have that, yeah, which many a time you may not, then your measurement and how you interpret it is really, technically speaking, only as good as the examiner, yeah, or the clinician in this case. Okay, I won't be talking about the polygraph. We'll talk about this in more detail when we meet face to face. But suicide assessment is something that's important to be familiar with, what you need to know. Yeah. You should be familiar with some of the common symptoms of suicide. Yeah. Um, and, when you do notice these behaviors, yeah, to take them seriously, and that you should intervene. Yeah, by intervening, meaning having a discussion with the individual so that you can determine to what extent they're at imminent risk to themselves for committing suicide. Okay. Now, when doing this, and we'll get into more detail about this when we meet face to face, but ultimately, when doing an assessment for suicide, you should find it's kind of like a three-pronged test. Yeah. What are they thinking to themselves? Yeah. What's the level of ideation? Yeah. It can be on a continuum. What is their level of intent? What is their to what extent do they intend to actually do this? Yeah, they're committed to doing this. And the third is, do they have a specific plan? Yeah. And the extent to which you have these three, the more you have these three things, some combination of these three things, and the higher the level of severity on each, the more it's going to direct you to whether the person is at imminent risk to their own safety. All righty. But again, we'll talk more about this when we have our face-to-face meeting. And with that, that's all I have to say about chapter 13. And with that, we'll progress to chapter 14. Thanks a lot.